Imagine going into a clinic for routine cosmetic treatment, right?
Sure.
You're hoping to stimulate a little collagen, maybe tighten up some tissue.
Right, a quick in and out procedure.
Exactly.
Yeah.
And instead, you inadvertently turn your birth control into a miniature heating coil inside your body.
Which is terrifying.
It really is. I mean, it sounds like some bizarre medical thriller, but as we're going to see today, it is a very real possibility when certain modern technologies collide.
What's fascinating here is how the glossy marketing brochures for these procedures paint a picture of, absolute effortless safety. But then when you cross-reference those brochures with the actual engineering manuals, the ones written by the people who build these medical devices, you uncover a glaring and, frankly, potentially dangerous disconnect.
Yeah, and we are diving headfirst into that disconnect today. We're looking at a highly specific question on this deep dive, one that affects millions of you listening. Can you safely undergo vaginal tightening treatments, things like lasers or radiofrequency procedures, if you currently have an IUD or a coil implanted?
Because the sheer volume of conflicting information out there is just staggering.
Oh, it's wild. It is the absolute definition of diagnostic muddy waters.
It really is. And to navigate this, we have to isolate the intersection of two very distinct medical technologies, right? We need to understand exactly how they behave when they share the exact same anatomical neighborhood.
Right. But before we can even look at how these things interact, I feel like we need to strip away the marketing jargon. We need to look at what these energy-based devices, or EBDs, as medical literature calls them, are actually doing to human tissue.
Because the terminology is tricky. The phrases they use, like laser rejuvenation or tissue tightening, they sound very gentle.
Right, like a spa day.
Exactly. But the biological mechanisms are heavily reliant on controlled trauma.
Yeah, traumas is definitely the key word here. So the clinics utilize two primary types of technology, right? You've got lasers, which are usually carbon dioxide or erbium YAG lasers, and then you have radiofrequency devices.
And they operate on entirely different physics, which is crucial for you to understand.
Let's tackle the lasers first. When I was reading through the clinical studies on fractional microablative CO2 lasers, I couldn't help but picture someone aerating a lawn.
Oh, that's a great analogy, actually.
Right, because when you aerate your yard, you're purposely driving this machine over the grass to punch tiny, controlled holes into the soil.
Yeah, it looks totally destructive on the surface.
Exactly. But that microtrauma forces the roots to grow deeper, and it stimulates the grass to come back thicker. And the fractional CO2 laser is essentially doing that to the vaginal tissue. It's punching tiny, controlled, microscopic holes into the tissue so the body just rushes to heal it, pumping out fresh collagen and elastin.
That visual is highly accurate for how fractional technology works. The clinical documentation we have notes that the CO2 laser specifically vaporizes the superficial lamina propria.
Okay, hold on. Superficial lamina propria sounds like a spell from Harry Potter.
Correct. Huh?
Translation, please.
Yeah.
We're just talking about the top layer of the skin inside the vaginal wall, right?
Essentially, yes. It's the thin layer of connective tissue that lies just beneath the surface epithelium, or the mucosal lining.
Okay.
So the laser vaporizes a minute fraction of this tissue, but it does so while strictly keeping the surrounding tissue temperatures between 45 and 60 degrees Celsius.
And that heat is the trigger.
Right. That specific heat range induces a biological healing response called neocollagenesis.
Which is the creation of new collagen.
Exactly. And neovascularization, which is new blood vessel formation.
Yeah.
And the key is that it achieves this without causing deep thermal damage or massive scarring.
Okay, so that's the CO2 laser. And then the erbium YAG laser does something slightly different. The medical texts emphasize that it has a much higher affinity for water absorption.
Yes.
So instead of completely vaporizing or ablating the tissue like the CO2 laser does, it exerts this gradual, controlled heating of that water-rich connective tissue.
Right, it disrupts the cross-linkages of the collagen fibers.
It literally forces those fibrils to shorten and shrink, and that's what gives that immediate tightening effect they market.
Precisely. But then we move to radiofrequency, or RF, and the mechanism changes significantly.
Because RF isn't a laser at all.
No, it doesn't use light energy whatsoever. RF devices utilize focused electromagnetic waves. So unlike lasers, which primarily target those superficial mucosal layers we just described, RF is designed to deliver energy much deeper. It goes right into the deeper connective tissue architecture of the vaginal wall.
So instead of like a beam of light burning a microscopic hole, the device is sending an electromagnetic wave into the tissue, and the tissue itself acts as a resistor.
Exactly. The literature calls it electrical impedance.
Right, so the tissue naturally fights the wave, and that friction or resistance is what generates the heat,
And that deep heating is completely intentional. It induces collagen contraction and activates what biologists call heat shock proteins.
which sounds intense.
It is. The entire goal of the radio frequency wave is to trigger a deep inflammatory response that eventually leads to structural remodeling of the connective tissue.
Okay, let's unpack this for a second. We have lasers causing superficial hot microtrauma, and we have RF sending deep electromagnetic heat waves through the tissue.
Right.
Now, let's introduce the IUD. Most of our listeners know an IUD is a small T-shaped contraceptive device sitting up in the uterus. But for this specific discussion, what really matters is the material it's made of.
Yes, the material is everything.
We basically have two categories. You've got hormonal ones, which are made of plastic,
Yeah.
and non-hormonal ones, which are tightly wrapped in fine copper wire.
And that physical distinction, plastic versus metal, is the exact point where these two technologies violently clash.
Yeah.
I mean, we are introducing intense energy fields into a localized area that houses either a synthetic polymer or a highly conductive metal.
And the clinics selling these procedures often just brush that detail completely under the rug. I was looking at the FAQ section from a major clinic in the sources of Avant Gynecology, and they claim it is, quote, perfectly fine to have deep RF treatments like Thermiva while an IUD is in place.
And their justification is purely anatomical, right?
Purely anatomical. They argue the IUD is up in the uterine cavity, safely away from the vaginal canal. And they literally compare the cervix to a bank vault door that protects the IUD from the RF energy.
A bank vault door.
Yeah. They insist the uterine wall is thick enough to act as an impenetrable barrier.
Okay, relying on the cervix to act as a bank vault door against electromagnetic energy demonstrates a fundamental misunderstanding of physics.
Yeah.
Electromagnetic waves do not behave like a physical object that just bounces off a closed door. They penetrate tissue.
I mean, are they seriously suggesting that human tissue just stops a radio frequency wave dead in its tracks?
They are. And the medical manufacturing data suggests that assumption is dangerously oversimplified. When you look at the stark warnings written by the engineers who actually build copper IUDs, that whole bank vault analogy collapses entirely.
I noticed that the safety manuals for devices like the 5-mini copper IUD and the Miudella device, they do not mince words.
No, they don't.
They explicitly instruct physicians and patients to avoid high medical RF transmitter devices or diathermy.
Right. Diathermy being a medical term for shortwave or microwave heating of tissue.
Exactly. The manufacturers specifically warn against using deep heating devices anywhere in the sacral or lower abdominal regions if a patient has a copper IUD.
And the reason is pure physics. Radio frequency can induce low-frequency currents within that fine copper wire.
It turns the contraceptive device into a literal heating coil inside the uterus.
Exactly. The electromagnetic field interacts directly with the conductive metal. That induced current heats the copper.
Wow.
And this can degrade the structural integrity of the IUD over time, sure, but far more immediately, it can cause severe thermal injury and internal burns to the delicate uterine lining that's touching the wire.
Okay, and here's where it gets really interesting. I was reading through the source material from Dermacare. They're a prominent clinic in Vienna.
Right, I saw that.
Amidst all their positive marketing about how great their laser treatments are, they drop this tiny, alarming caveat. They state that if a copper or hormone coil is used, the contraceptive safety of the device might actually be reduced as a result of the vaginal treatment.
See, and that single caveat completely shatters the bank vault theory.
Exactly.
If a clinic admits that the treatment can alter the contraceptive efficacy of the device, whether that's by melting the plastic, altering the precise hormone release mechanism, or disrupting the copper ions, then they are conceding that the energy is absolutely not being blocked by the cervix.
Right.
The energy is reaching the IUD.
It is such a jarring contrast. You have a doctor at a wellness clinic saying, come on in, the bank vault will protect you, while the engineers who designed the copper coil are waving their arms yelling, do not put this highly conductive metal object into a microwave field.
If we connect this to the bigger picture, this conflicting advice about IUDs isn't just an isolated oversight by a few careless clinics.
No, not at all.
It is a symptom of a much larger, essentially unregulated Wild West scenario surrounding the entire industry of vaginal rejuvenation.
Calling it the Wild West feels incredibly accurate, especially when you look at how the major regulatory bodies are reacting. The U.S. Food and Drug Administration has been remarkably explicit about this.
Very much so.
They have not cleared any of these energy-based devices specifically for cosmetic vaginal rejuvenation, nor for treating vaginal laxity or improving sexual function.
Right. Their approved uses are much more clinical and surgical. These devices are cleared as general gynecologic tools.
For things like destroying genital warts, right?
Exactly. Warts, ablating precancerous cervical tissue, or general tissue coagulation during a surgery. Using them for cosmetic tightening or treating menopause symptoms is entirely off-label marketing.
And the FDA commissioner back in 2018, Scott Gottlieb, he issued a very stern public warning about this exact off-label use.
He did.
He stated the agency was deeply concerned that patients were being harmed by deceptive health claims. The FDA pointed out that the safety and effectiveness of using these lasers and RF devices to cosmetically reshape tissue simply hasn't been proven in any robust, long-term scientific studies.
And that regulatory skepticism extends well beyond the U.S. The U.K.'s National Institute for Health and Care Excellence, commonly known as NICE, also intervened.
Right, they had a lot to say.
Their official guidance does not recommend the routine use of transvaginal lasers for urogenital atrophy or laxity. They emphasize that the clinical evidence is incredibly limited, and they strongly urge patients to pursue conservative proven care first.
By conservative care, they're talking about interventions that have decades of proven safety data.
Yes.
Things like targeted pelvic floor rehabilitation, specialized physiotherapy, or topical estrogen creams. They want patients trying those before letting someone fire a laser into their mucosal tissue.
Because the FDA and NICE are not just being overly cautious bureaucrats here. The risks associated with these energy devices are documented, and they are severe.
Yeah, I spent some time looking at the FDA's MIUDE database.
Oh, the adverse events.
Yeah, that's the system where doctors and patients report adverse events with medical devices. The complications log there are horrifying. We aren't just talking about a little irritation. Patients were reporting severe third-degree vaginal burns, dense internal scarring, and chronic bladder pain.
And high rates of de novo dyspareunia.
Right. And for those unfamiliar with the term, de novo dyspareunia means the onset of entirely new, severe pain during sexual intercourse that absolutely was not present before the cosmetic treatment.
Exactly.
In some of these MIUD reports, patients suffered such severe nerve damage from the thermal energy that they had to be prescribed intense nerve pain medications, things like gabapentin or pregabalin, just to manage their daily chronic pain after these so-called rejuvenation procedures.
It's devastating. But we must also examine the counter-narrative presented in our source material.
Right, to be fair to the clinics.
Right. Some major clinics heavily push back against the FDA's warnings and defend the technology fiercely.
The Women's Health Clinic in the UK, for instance, released a very aggressive, detailed rebuttal to the FDA. They argue that CO2 lasers, specifically, have a 35-year safety record in the medical field.
And their core argument is that the tool is not the problem. The operator is the problem.
Operator error.
Yes. They assert that the horrific complications logged in the MIUD database arise from poor practitioner training. They point the finger at non-medical estheticians or underqualified med spa employees who are exploiting regulatory gaps rather than the lasers themselves being inherently dangerous.
But, I mean, are we really supposed to believe it is just an operator issue? Even if the person holding the wand has a medical degree, that doesn't change the physics of a radio frequency wave hitting a copper coil.
Well, the clinic attempts to address the technical side by drawing a strict line between different applications of the technology.
How so?
They point out that a high-powered surgical laser used to destroy cancer cells operates at a completely different power output, depth, and modality than a fractional laser calibrated for superficial tissue remodeling.
Wow.
In their words, comparing the two is like comparing a high-speed sports car to a bicycle simply because they're both modes of transport.
Okay, I understand the car versus bike analogy for a superficial CO2 laser. I really do. If it's calibrated perfectly, maybe it only grazes the surface. But that defense completely ignores the deep tissue radio frequency problem.
It does.
RF is designed to go deep. It is specifically designed to heat the connective tissue near the uterus. So even a perfectly trained doctor operating an RF machine perfectly is still sending an electromagnetic wave into a space occupied by a highly conductive copper IUD.
Exactly. The clinics defending the technology often blur the lines between CO2 lasers and deep penetrating RF devices, marketing them all under the umbrella of rejuvenation.
Which is confusing for the patient.
Very. The fact remains that regulatory bodies feel the aggressive marketing has vastly outpaced the actual clinical evidence for safety, particularly regarding contraindications like metal implants.
So what does this all mean? If someone listening to this deep dive is currently dealing with symptoms like laxity or dryness, has an IUD, and is being bombarded with Instagram ads for these life-changing treatments, how do they protect themselves?
The absolute most critical takeaway from synthesizing all these conflicting sources is the necessity of rigorous, individualized clinical assessment.
Right.
Vaginal laxity is not a single, simple diagnosis that can be universally zapped away. It is highly multifactorial.
You have to figure out why the symptom exists in the first place. I mean, is it actually a looseness of the mucosal connective tissue due to hormonal changes? Or is the root cause actually pelvic floor muscle weakness? Or perhaps a mild pelvic organ prolapse?
Distinguishing between those causes is vital. Energy-based devices, even if they successfully stimulate collagen in the superficial mucosa, will absolutely not fix a structural pelvic organ
No,
prolapse.
of course not.
They cannot magically strengthen weak pelvic floor muscles. If a patient's issue is fundamentally muscular, no amount of superficial laser ablation or deep RF heating is going to solve it. It will only expose them to unnecessary risk.
This just highlights why you have to be your own loudest advocate, especially if you have a copper IUD. If you walk into a med spa or a clinic and they blindly say, yes, we can treat you with a deep penetrating radio frequency device without specifically checking the manufacturer's contraindications for your exact copper coil.
That is a massive flashing red flag.
Exactly. A massive red flag.
Because a clinic skipping that step demonstrates a profound lack of understanding of the physics involved, which, as the FDA database proves, can lead to severe internal burns and chronic pain.
So before anyone even considers booking one of these procedures, you need a clear medical diagnosis of what is actually causing the symptoms. The reputable clinics in our source material strongly advise getting a recent PBI smear, ideally within the last 12 to 18 months.
Yes, that's crucial.
You absolutely must ensure you do not have any abnormal cervical cells, because firing a laser into precancerous tissue can inadvertently spread or accelerate the issue.
And most importantly, you need a frank, detailed discussion with a doctor.
Not a salesperson on commission, right?
Exactly, a doctor. You need to know the exact type of energy device being used. Is it superficial CO2? Is it deep RF? And how does that specific energy wave interact with the specific material of your implanted device?
Right.
And this raises an important question regarding a biological mystery the clinical sources touch upon but leave completely unresolved.
Oh, I love a good medical mystery. What did the sources leave out?
Well, we know from decades of medical literature on IUDs that the human body occasionally spontaneously expels them.
Right, it just pushes it out.
Yeah. Between 2 and 10% of cases in the first year end with the uterus simply pushing the IUD out because the body recognizes it as a foreign object. The immune system flags it, creates an inflammatory response, and evicts it.
Okay, and we also know that the primary mechanism of these vaginal rejuvenation treatments, whether laser or RF, is to purposefully create massive localized tissue trauma.
Right.
The entire goal is to trigger an inflammatory healing response, activate heat shock proteins, and flood the pelvic region with inflammatory markers to build collagen.
So consider the biological cascade we are initiating here. We are purposefully causing intense, repeated inflammation right next to the uterus, which is currently holding a foreign object.
Wow. We really want our bodies to be simple machines with clear user manuals, We want to be able to plug in device A without it ever affecting implant B.
But the human body isn't a machine.
It's not. It is a highly reactive, interconnected ecosystem.
All right.
And when we introduce new, intense energies into that ecosystem, we are still largely in the dark about the ripple effects. We've looked at the physics, we've looked at the burns and the clashing regulations. But based on how the body's immune system naturally reacts to foreign objects, could that intense, localized inflammatory response triggered by multiple rejuvenation sessions inadvertently signal your immune system to attack or expel your IUD?
Even if the heat never actually melts the plastic or induces currents in the metal.
Exactly. It is a fascinating biological question that the clinical trials haven't even begun to answer. So that's something to think about before you book that consultation. Keep questioning those easy answers. Keep advocating for your own health, and we will catch you on the next deep dive.